This webinar is brought to us by the Africa Respiratory Care Association and proudly sponsored by Zopec Medical. So Zopec Medical offers innovative, safe, and uninterrupted power solutions. They are at the forefront of the respiratory care industry. So the Zopec Medical designs advanced hospital-graded power solutions that ensure uninterrupted power for critical care, respiratory care, and neonatal care equipment. They are trusted by health systems nationwide and across the globe. And their technology improves patient mobility, enhances safety, and supports continuity of care during power outages and transport. So if you are a hospital facility or you have a care home, or you need a power solution that can support your equipment whilst you transport your patient or you keep your patient mobile, kindly contact Zopec Medical at info@zopec.com, or you can call them on +1 888 468 7108, or you can contact the Africa Respiratory Care Association through info@africares.org, or you call or contact either by call or by WhatsApp on +1 470 357 3590. And at Zopec Medical, we say powering critical care mobility with confidence. Today, we have an important and a very great personality in our midst. Now, what if the most powerful medicine for your mind and body was simply sleep? Now, good sleep fuels your immune system, sharpens your memory, and protects your heart. Yet, the impact is often underestimated. Now, today, we are honored to learn from someone who understands every angle of sleep. Her name is Dr. Adele Sierra. She serves at the Georgetown Public Hospital Corporation in Guyana and is an active member of the Africa Respiratory Care Association. Join me in welcoming Dr. Sierra as she presents on sleep health, uncovering the hidden health impact of sleep. Dr. Sierra, your audience, our presenter. Thank you.
Thank you so much. Hello again, everyone. Thank you so much for being here today. Sleep is something that everyone experiences every night. Despite its importance sometimes, is often underestimated. Today, we are going to present sleep and health, covering the hidden health impacts in our life. Today, I'm excited to share with you some keys insight into sleep medicine, how sleep works, common sleep disorder, and why underestimating the sleep is essential for improving our overall well-being. Let's dive into the fascinating world of the sleep together. We have the learning aims. Understand the physiological importance of sleep and it is a relationship with overall health. It's important to recognize common sleep disorder and describe the roles of a healthcare professional too. Here we have our objective. Describe the state of sleep, explain how sleep affects major body systems. It is important to identify consequences of sleep deprivation on physical and our health and classify the sleep disorder. Explain the role of a healthcare professional and describe the assessment tool. What is a sleep medicine? Well, this is a very important, question, I think, no? Because sleep medicine is more than a diagnosing insomnia or prescribing some sleep pills. It is an entire specialty focused on understanding how and why we sleep and what happens when that process is interrupted. Sleep medicine covers different specialty, like, for example, pulmonologists, neurologists, psychiatrists, ENT specialists. We have the dentists, we have the pediatricians, psychologists, and very important, the respiratory therapists too. It's important because we can understand the neurobiology of the respiratory physiology and physiological factors and circadian timing. And it's also important to emphasize, that public health, need to understand what is the importance of the sleep disorder, because this disorder can increase the cardiovascular disease, the metabolic dysfunction, the accidents, and mental health disorder. Historical background of sleep medicine. Understanding sleep started at, we can say, a spiritual quest and evolved into one of the most technology-driving area of medicine today. We can say ancient texts, for example, Egyptians and Greeks, and we can say the Bible too, like understand the dreams like the divine message. We can see that, for example, in the book of Genesis in the Bible with the Joseph dreams, and we can see too, for example, in the Daniel book, that we can say Nebuchadnezzar, dreams. These are some, example about how at the beginning the ancient people understand the process of sleep. But in the 18th, sleep was wrongly considered as a passive state where the brain was shut down completely. After, we can say in 1929, Hans Berger invented the electroencephalogram, allowing visualization of the brain wave. And in 1937, Lorenz and Errol described the first stage of sleep using the electroencephalogram. In 1953, a scientist and Kleitman discovered REM sleep and linking it to dreaming. This is very important. And in 1970, developing the polysomnography and the first sleep labs was a big step that we have in the sleep medicine. In 1975, the Association of Sleep Disorder Centers, now American Association of Sleep Medicine, was founded. And we have, in 2007, sleep medicine was officially recognized as a medical subspecialty by the American Board of Medical Specialists. What is sleep according to the American Academy of Sleep Medicine? We can say sleep is defined as a reversible behavioral state of perceptual disengagement from the unresponsiveness to the environment. Although sleep was once thought as a passive process, it was recognized as a highly active that involved complex neurobiological mechanisms. During sleep, the brain is engaged in critical functions such as memory consolidation, cellular repairs, and the regulation of metabolism and immune function. What are the essential functions of the sleep? We can say neural repair and waste clearance is very important. The lymphatic system flushes out toxins. It's similar to our lymphatic system, but this lymphatic is working in our brain. And then it is a network of channels around the central nervous system, blood vessels, that clear metabolic waste and deliver nutrients, mainly during the deep sleep. This process relies on cerebrospinal fluid flow through a space around the vessels, aided by aquaporin 4 protein in glial cells, especially astrocytes. The second essential function, we can say, is the brain restoration and memory consolidation. Non-REM support declarative memory, and REM supports procedural and emotional memory. Non-rapid eye movement, that's the meaning of non-REM, and rapid eye movement is the meaning of REM. Then, declarative memory is related with the facts and events, then mainly consolidated during the slow wave sleep, deep non-REM sleep in the stage 3, that we are going to talk more about that when we continue the presentation. During this stage, the hippocampus replays information to the cerebral cortex for long-term storage. This process is called system consolidation and can take hours and days after learning. The lymphatic system, which cleans the brain during the deep sleep, also helps create an optimal environment and consolidation. And non-declarative memory that is like related with the skills and the habits. Consolidating mainly during the REM sleep, the rapid eye movement, stage of the sleep, with brain activity is high and motor and emotional skill are processes. The cerebellum and basal ganglia are especially active in this phase to strengthen the procedural memory. Learning and plasticity also occur while awake, but REM sleep is something that improves our skill, precision, and automatization. We have the emotional regulation. We say the sleep, play a role with the emotional regulation because it reduces the amygdala reactivity. We have the immune support because during the slow wave sleep, immune cells can proliferate. And we have the hormonal and metabolic balance. It's very important because when we have a lack of sleep, we can have an increasement in the ghrelin and reduce lectin and increase the appetite, and the cortisol can increase too, and we can have risk of obesity, diabetes, and insulin resistance. Chronic sleep deprivation leads to arterial hypertension and maybe bad control or difficult control to the high blood pressure, obesity, diabetes, depression, cognitive decline, lost memory, pulmonary hypertension, heart failure, among others disorders. Getting enough sleep every night is one of the most important aspects of the human health. Yet about 30 to 40% of the adults suffer from insomnia. WHO has called our lack of sleep like a public a pandemic or epidemic. Important because we should make sleep a priority in our life. Here we can see how 1 in 3 adults don't get enough sleep. And we can say when we sleep, less than 6 hours, we have 13% higher mortality, risk mortality. And when we are sleeping less than maybe 7 hours, we have like a 30% of the probability to develop obesity. What are the benefits of good sleep? Well, we have the healing and repairing. Our cells is going to heal, is going to repair, our metabolism is going to be better, and we are not going to have a lot of inflammation in our body. We can increase our creativity and productivity, and we can have a better brain function. We are going to have a stronger immune system, and we can improve our mood. We are going to be like a more like a, we can say, like a happy. We are not going to be irritated most of the time. We are going to have more energies. It's going to produce a healthy growth for our children and our adolescents. Here we have this graph that show how much sleep do we need. Well, depends the time of our life, depends the age. And remember, this is like a generalization, because every time when we are going to see a patient or a person, we have to think about this is an individual, and we have to evaluate the person, like like a group. But this is a presentation, and we are going to show approximately how much hour. When we have the newborn, should sleep approximately 14 to 17 hours. The infants can sleep like maybe 12 to 15 hours. Toddlers, 11 to 14 hours. Preschoolers, 10 to 13 hours. School age from 9 to 11. Teen, 8 to 10. We have to pay attention to the teens, and they sometimes need to sleep a little more, and they are, having a shift, time because they go to sleep later and they want to, wake up later too. Then the young adult, we can see that we need to sleep. The young adult need to sleep from 7 to 9 hours, and the adults need to sleep from 7 to 9, and the older, adults like maybe from 7 to 8 hours. What about the circadian and ultradian rhythm? We can say like sleep is not a passive shutdown, but it's essential and dynamic process for the life maintenance. Then sleep is divided into REM and non-REM pattern. We can see here the circadian is like a 24 hours rhythm that we have. We were designed like to wear to enjoy like maybe our life and to do different activities during the day when the sun is brightened. But we have the night to sleep. That's the designer that we have. There are other animals that we can see they have different kind of circadian rhythm, but we need, to sleep during the night. It's regulated by suprachiasmatic nucleus in the hypothalamus and influenced by the light, by our retina. Then when the sunset coming, then it's sending to our brain like a signal that then is a time to go down, is the time, to sleep. Control sleep and wake time. Melatonin secretion increase, the temperature can decrease, and we need to, to rest. But the ultradian rhythm is something that happens during the time that we are sleeping. It's something that happens every 90 to 110 minutes. Refer to the cycles, that alternating between different states of sleep, non-REM and REM, and it's happening 4 times per night. Each cycle includes progressively longer REM periods. What about the architecture and the physiology of the sleep? We can see here like how we can divide the sleep during the night. We have the non-rapid eye movement, and the stage 1 is the light sleep. Slow eye movement, the electroencephalogram can show theta wave, and this is the time that is short period that we sleep, like maybe that we pass in like maybe 1 to 7 minutes, and sometimes we have this sensation that we are going to fall. The second stage is the N2. Sleep spineless and can appear in the electroencephalogram and key complex and lost environment awareness. We started having, different, like a disengagement from the environment. And the stage 3 is a deep and slow wave with the delta wave dominance and critical for the physiological and immune function. And the REM sleep is a rapid eye movement. We have the electroencephalogram resemble wakefulness. Well, our brain is working a lot. We are, having, like a similar resemble that when we are awake, and our muscles, have atonia, except, the diaphragm and the eyes muscles. It's essential for emotional regulation, learning and memory consolidation. REM periods lengthen, as we were talking about before, with each cycle during the night. Here we have the same, but this is a graph that shows how we are, during the night. every 90 to 110 minutes, we can have this, cycle. It started with the light sleep. After we go to the second stage, that the eye movement and muscle activity stop it, and the brain wave is slowed down. But the stage 3 is when we are completely sleepy, and it's so difficult to awake the person. And if you awake, you are going to be disorientated, because this is the deep sleep. This is a very, very slow delta wave. And we have the REM, when it's a paradoxical, time when the heart and breathing and blood pressure can have some a rise and maybe increase, and the body is going to be paralyzed. But the eyes is going to be moving, quickly, and we can have our dreams. Here, this graph show as I told you all about how the cycles happen during the night, and how the REM sleep is going to be lengthened, increasing during the time is passing. We can see that the stage N2 is going to be approximately 50% of the sleep, and we are going to have more REM sleep during the morning, is passing close to the awake time. How sleep stage change during our life? Well, from birth to the old age, the structure of the sleep, meaning the proportion of time that we spend in each stage, can change significantly. Because when you are a newborn, a baby, the sleep is polyphasic, occurring multiple and short periods throughout the day and night. The newborn is sleeping and wake up, to feed. Around the 50% of the total sleep is REM. Active sleep is REM, much higher than in another stage of our life. And non-REM stages are not yet clearly differentiated in this moment of our life. But deep sleep N3 is going to develop maybe gradually. The infants, sleep begins to consolidate in the longer nighttime periods plus daytime naps. REM proportion decrease about 40% of the total sleep, and non-REM stage become more defined, and slow wave sleep N3 emerge, because it's very important, because the infants are growing. And remember, the non-REM the stage 3, the N3, is very important for the memory consolidation too. And the growth, because at that moment, at that point, the growth hormone is released. Well, here we have the school-age children, that the REM stabilizes around 20-25%, N3 remains high, 20 to 25, and supporting intense physical activity. Growth and memory consolidation, most children no longer nap unless they have deprivation of sleep. These children is not going to have any nap anymore, at least they have some deprivation. But we see how the REM, the non-REM stage is going to remain a high, because they are growing. Adolescents, we have the adolescents, the proportion remains similar to school age, a REM is 20-25%, and 3 is from 10 to 20. There is a natural shift toward, as we talked about before, later sleep onset and wake time. It's a delayed sleep, because they go to sleep late, but they are going to awake later. And sometimes it's difficult, because in this time of our life, sometimes we don't understand why the adolescents have this kind of behavior, but this is normal in their life. And deep sleep duration begins a slow decline. And young adults, REM sleep remains 20-23%, and 3 accounts for about 15 to 20% of sleep. Sleep efficiency is generally high, with fewer waning. We have with the adults that they gradually is gradually reducing, the N3, and the N2 that the light sleep becomes dominant, reaching about the 50% of the more total sleep time. We saw in the graph that usually the N2, the phase in the non-REM N2 is the 50% of the total sleep, mostly in this kind of our life, in this time of our life. And the other adults, like it's more than 60 years, N3 is markedly reduced, often under 5 to 10%. Then N2 may account for over 55% of total night. That produce that, the REM decrease slightly, and the stage 1 and brief awareness, increase, leading to lighter, more fragmented sleep. When the people that is older adult, sometimes they can complain about the sleep because they are not sleeping well, because they are sleeping less amount of hours. The problem is usually in this time of our life, our sleep is more light than before. We have less N3, and then we have more awakening during the night. And sometimes when they wake up, maybe they feel like they were not sleeping, the amount of hours that they needed. REM sleep is a higher, we can say, during the adult age, and deep sleep N3 peaks in the early childhood, then progressively decline with the age. Light sleep, like N2 and N1, increases steadily over the lifespan, and the sleep becomes less consolidated and more fragmented, when we are old adult. Here we have how is the average of our sleep in general, if we are going to divide, in different stages. When we go to general, we can say the N1 is the light sleep, is approximately the 5% of the total time that we are sleeping. N2, the light sleep, is 45 to 55%, largest portion of our night. We can see that more of the time that we are sleeping is related with N2. N3 is a deep, slow wave sleep, is 15 to 20%. It's a more restorative state of our sleep. And the REM, the rapid eye movement, is approximately 20-25%, important for the memory consolidation, for learning, and for the metabolic regulation too. What about the systemic physiological change during sleep? Here we have, different, systems, and we are going to be talking about how is going to affect, how the sleep is going to affect the respiratory system, for example. During the non-REM sleep, the respiratory rate is slightly, reduced. And during the REM, we can see that the respiratory become irregular. The tidal volume can reduce in the non-REM sleep. In REM sleep is going to reduce to more. And ventilatory response, like maybe to CO2, carbon dioxide, oxygen, is going to be blunted, but it's going to be severely blunted during the REM sleep. The upper airway tone, well, we are going to have a reduction in the tone of the upper airway, but this one is going to be markedly reduced during the apnea, during the REM sleep, that maybe increase the risk for apnea. Diaphragmatic effort. Diaphragmatic effort is going to be preserved in both, like stages, but we are going to have a decreased tone in the rest of the muscle. Just, the diaphragmatic, and the eyes is going to be like a maintenance and the tone. In REM sleep, the breathing becomes irregular, and airway and the muscles and the upper weight are relaxed, which is why is when obstructive sleep apnea in OSA are more severe. Then the people that suffer from obstructive sleep apnea during the REM time, they have more risk to develop more, or to have more amount of episode of apnea or hypopneas. What about the cardiovascular system? We have the heart rate. The heart rate usually decrease, during the non-REM. Maybe can be like a increase or decrease rapidly during the REM sleep because the surge of the sympathetic, system. The blood pressure can reduce 10 to 20% during the non-REM sleep and can have some fluctuation during the REM sleep and can spike. That is something that happened during the REM sleep, that because the people have that have more risk to develop different kind of how can I say, maybe heart attacks or any neurocerebrovascular accident. Autonomic tone, the parasympathetic is predominant, we can say, during the non-REM, but the sympathetic surge, especially with the arousal. Arousal is the micro awakening that we have during the time that we are sleeping, that sometimes it's normal, to have some arousal during this time, but sympathetic surge, produce that maybe the fluctuation of the heart rate and the appearance of some arrhythmias, because the people that are predisposed to this, maybe they have increased risk, to developing any malignant arrhythmia. We can say no REM allows the heart to rest, but during REM, sympathetic spikes and can trigger arrhythmia, and in vulnerable patient is going to be definitely worse. Thermoregulation, that we say that maintenance, but the temperature usually reduced during the first stage of the sleep, and then during the REM time, even though it maintains, sometimes it can be suppressed because the many changes and the amount of change that the body have, and the sympathetic surge that happen during this time. We can say the gastrointestinal motility reduce, and during the REM sleep could be variable. Renal, well, during the non-REM sleep, urine output is going to decrease and increase the vasopressin hormone. That's why when we are sleeping, we don't have problem. But if we don't have a good sleep, sometimes we have to go to the washroom many times. Then during the REM sleep is maintained, but the regulation is less effective than in the non-REM sleep. That's why sometimes the enuresis occur during this period usually. Endocrine system is very important. We can say that the growth hormone released in N3 and cortisol is reduced during the first part of our sleep, and cortisol started rising during the time that we are going to awake. The melatonin peaks during the night, promote the sleep, during the early night, and decrease by the time is passing. But the cortisol, reduce during the first stage of the night, and is rising close to the time that we are going to wake up. Growth hormone, as we were talking about, increase in the N3 stage. Prolactin increase too during the sleep, and the insulin sensitive is decreased if we are sleeping well. But if we have any problem during the time we have some deprivation of sleep, the insulin resistance can increase. Then during this time, the leptin and ghrelin can have some changes. Leptin is a hormone that is going to reduce the appetite, and ghrelin is the hormone that is going to increase the appetite. Then when we are not sleeping well, we are going to have some like imbalance, and then if we have more ghrelin, our appetite is going to increase, and we can develop obesity. We can say lack of sleep alters leptin and ghrelin and increasing the appetite, as we were talking about, and increase the risk of obesity. And when we are not having a good sleep too, we can have more cortisol in our blood, and then we have more risk to develop different metabolic problems like put on weight, like increase our weight, obesity, and diabetes. And what about with the neurological and cognitive, during the non-REM sleep, especially N3, synaptic downscaling, memory consolidation, declarative neuroplasticity. During the REM sleep, emotional memory processing, problem solving, creativity. And we have the lymphatic system. Remember, we talked about that. The lymphatic system is similar to our lymphatic system, but this one is in our brain. That is trying to clean our brain. And then when we clean the beta amyloid, and the break toxins, we have less probability to develop different kind of disease. It's during the deep sleep that the brain cleans itself. It is why deep sleep deprivation like produce or accelerate dementia. We have here the way promoting neurotransmitter. We have here the norepinephrine. Norepinephrine, usually we can see promotes the attention, arousal, and vigilance. But then if we have a deficiency or any deficit of norepinephrine, we are going to have more somnolence, and we are not going to be attentive. We are going to have some problem with the attention. Serotonin. Serotonin regulates the mood and the sleep. Initiation suppress the REM sleep. Then if we have deficiencies of serotonin, we are going to develop REM sleep disorder. We are going to have some problem like disorder with the REM sleep. Acetylcholine facilitates the REM and the wakefulness, learning, and memory. Then when we have any deficiency of this, decrease the REM sleep and the cognitive declines. We have the histamine that is another, like a neurotransmitter that is promoting the awakening, and we can say maintains cortical arousal. Then if we have any lack of histamine, then we are going to have daytime sleepiness and sedation. It's like when we use antihistaminic, well, it's something like, it's similar. We have a lack of histamine, and we are going to develop daytime sleepiness and sedation. Dopamine motivates behavior and support the wakefulness. When we don't have enough dopamine, we are going to feel fatigue. We are going to feel apathy. We are not going to have we are not going to have the disposition to do. We are going to have a lack of energy. And orexin or hypocretin, that is another neurotransmitter that is very important. It stabilize the wakefulness and prevent unwanted transition to sleep. This is the problem that happens in the people with narcolepsy type 1. When we have a deficiency of orexin or hypocretin, but are the same, then the people developing, the narcolepsy type 1 with cataplexy. The immune system. The immune system, we can say during the N3 sleep, increase the cytokines, interleukin-1, TNF-alpha, and that promotes immune response. But sleep deprivation is going to reduce the T-cell functions, increase the susceptibility to the infection. For example, vaccination response is more effective when we have adequate sleep. Even one night of poor sleep can suppress our immune system. Sleep is your natural defense booster. Sometimes we forget that sleep is very important, because with the technology that we have today, with the lights that, we can be working, studying for many hours, And sometimes we forget that sleep is medicine too. Here we have the sleep promoting neurotransmitter. Then we can say the GABA. This GABA aminobutyric acid is a neurotransmitter that inhibits, the wake promoting neurons and induce REM sleep. Then when we don't have enough GABA, we are going to have insomnia. Our sleep is going to be more fragmented and we are not going to rest properly. Glycine causes REM muscle atonia via inhibition of the motor neurons. Then when we have lack of glycine, then REM sleep behavior disorder, is going to arise. And adenosine is like a bill of sleep pressure and is suppressed by caffeine. But sometimes we drink, a lot of caffeine. Well, the efficiency of adenosine is going to reduce sleep drive and produce insomnia. Here we have the key hormones. This is we are going to repeat something that we were talking about before, but then we have the melatonin. Melatonin is the hormone that is released when sun sets. Then it's like a signal that we have that this is the time to sleep. And then melatonin is released from the pineal gland, the posterior part, and induce the sleepiness peaks at night. Cortisol is released in the adrenal cortex and regulate alertness, the time to awake. The growth hormone we can see is produced in the pineal gland or pituitary in the anterior part of them, and the secretion is small during the slow wave sleep N3 and can lead to tissue repair too. We have the lectin that we mentioned before, lectin and ghrelin. Lectin is coming from the fat tissue, and during the sleep, we increase this hormone and reduce the appetite. When we are sleeping, we are not thinking about to eat. Then when we don't have a good, sleep, we are going to increase our appetite. Then I don't know, when we have one night that we are not sleeping well, we are thinking, oh, our stomach is feeling this sensation that we need to eat. It's because ghrelin is released in the stomach, and then we feel hunger. Here we have the classification of the sleep disorder by the American Academy of Sleep Medicine, and divide, in 7, types. We have the insomnia disorder. That's the first group. Difficulty initiation or maintenance the sleep. Could be chronic, could be short-term insomnia or adjustment insomnia. Sleep-related breathing disorder. We have this group that is very important for the pulmonologists. And then the first or the most common sleep-related breathing disorder is obstructive sleep apnea. That is characterized by the repeated airway collapse during the night and the desaturation. We have the central apnea. The brain fails to send the proper signal, and then we have the apnea. We have the sleep-related hypoventilation disorder or hypoventilation syndrome, and we have the sleep-related hypoxemia disorders. The other group is the central disorder of hypersomnolence. Here we have the narcolepsy type 1 that is together with the cataplexy. Okay, it's characterized for the cataplexy is when the people, sleep so fast and suddenly, the tone of the body is completely lost and the people, fell down. It's related with the low orexin. And we have the narcolepsy type 2 that doesn't have the cataplexy, idiopathic hypersomnia, Klein-Levin syndrome. This syndrome is very weird and sometimes appear like a episodic, maybe the people can be normal for a time and happen again sometimes. have some maybe some disorder too with the sexual behavior sometimes, together with the hypersomnolence, and we have others disorder or hypersomnolence problems. Here we have the circadian, problem. We have the advanced wake phase disorder, the delayed sleep phase disorder. We have the irregular sleep wake rhythm disorder, the shift work disorder. These today in our society, we know many people is working during the night. And then, for example, if you have any kind of work, like if you're a doctor, if you are a respiratory therapist and you are on duty this day, you are not sleeping, you have to be awake. Then you have, or maybe you are doing like you are a person that used to care different places, like and then you have a work that maybe I work the whole day and I'm going to rest 2-3 days. This is something that produce a disorder in our circadian rhythm. We have the jet lag when we maybe travel to another zone. Then like maybe we are here and we are going to travel to Europe, and many difference of hours between, and then we have this kind of disorder that we have to adjust our circadian rhythms. We have the synchronization between internal clock and external environment. Is that the people have this kind of problem that don't recognize properly, the external environment, because our internal clock have some difficulties. Parasomnias, well, the parasomnias can come, with a non-REM sleep related, like maybe the sleepwalker, a sleep talker. We know some people is talking during the night, and it's not, sometimes it's not often, it's not going to be a big problem, but we have the people that, sleep walker is worse, because you don't know if the people is going to walk around and can have some accident. Sleep terrors, confusion or arousal, that maybe you awake that you don't know exactly, because you are in the REM phase, in the non-REM phase, that is deep sleep. We have the REM-related parasomnia, like sleep paralysis. You are completely paralyzed, you cannot do anything. We have the nightmare disorder too. And we have other hypersomnia, like exploding head syndrome, hallucination, and sleep degeneracy that is more common in children. We have the sixth group, that is the sleep-related movement disorder. We have the restless legs disorder that sometimes is related with the deficiency of iron of the ferritin. We have the periodic limb movement disorder. Sleep-related leg cramps that happen sometimes. It's often that our patient sometimes comes and say, well, I'm having some cramps during the night. The bruxism is like this movement that we have in our mouth, that sometimes our tools are moving, or maybe we are having a high tone in our mandibular. Then it's sleep-related rhythmic movement disorder too. And we have other sleep disorders that maybe isolate symptoms and normal variants, like long sleeper, people that sleep too much, or people that don't need to sleep too much, among other disorders that are not classified. How we can do the diagnosis of the sleep disorder? Then, as we do in any other kind of specialty, the most important thing is the clinical evaluation. The clinical evaluation is going to guide us, to have a good history. And then we have to investigate. We have to ask our patient about the history, sleep habits, symptoms, family history. When we go to the physical examination, we have to focus on upper airway, cardiovascular, neurology, and respiratory. We can use a standardized questionnaire, like a Epworth sleeping scale or stop band. We usually use this in our clinic to evaluate how how is the excessive daytime sleepiness, and how high could be the risk, for example, to have any sleep apnea. The gold standard is test is the polysomnography. Polysomnography is the gold standard test, and it's polysomnography in lab that is coming with the electroencephalogram, the electrooculogram, the muscle tone, we are going to have the airflow. We are going to have the respiratory effort. We have the electrocardiogram, and very important, the oxygen saturation. The home sleep testing is like a mini version of the polysomnography. We use usually in people that doesn't have any other comorbidity, and we are suspecting a sleep apnea. And this one is have fewer, parameters to be analyzed, that the airflow, the respiratory effort, that is very important too in the polysomnography. I don't remember if I mentioned. We have the oxygen saturation too. Then, in order to have an idea if the people have any obstructive sleep apnea. When we go to do like the multiple sleep latency test, this is usually done after we have the night polysomnography. We usually do this test in people that we are suspecting narcolepsy. Then we are going to do, and we are going to see that people with narcolepsy usually is going to sleep so fast. And when we analyze, they are going to enter usually directly in REM sleep. The maintenance of wakefulness test is important in order to know with a good environment how much time the people could be awake, because, for example, is the person have a critical worker, mission worker, like maybe a pilot, a driver, or is an operator of a machine, then we need to know exactly what happened because the accident can occur. Then we have the actigraphy, that is something that we use, maybe the wrist device that we can use for days or weeks, and we can see how is the behavior of the sleep and the awakening, to know exactly, or to investigate around the circadian sleep disorder. Video monitoring is very important because with this kind of problem that may be related with the REM sleep or no REM, in order to know if the people have any like a sleep walking or something, or any movement in the legs that we can see with the video. And other laboratory and images tests that we can do is when we need, for example, to rule out any other problem, like we're thinking there is any problem, like maybe like any tumor or something, we can order CT scan, MRI. For the restless legs movement disorder, we can order like a iron and ferritin too. When we go to talk about the roles of the different specialties in the sleep medicine, we can say, we can reinforce that sleep medicine is like a subspecialty. And then we have to work, like it's a multidisciplinary specialty, so a specialty that we have to work together. And everybody have a role here in this specialty. Then we can start with the pulmonologist, like maybe usually we are involved in the diagnosis of sleep-related breathing disorder, sleep apnea, but we can mention the neurologists too. Neurologists are very important because they can help us, in interpretation too about the sleep wave when we are doing the electroencephalogram, and we have to interpret the polysomnography together with us. We can say the narcolepsy is something that is very important for the neurologist, to follow up, and we have to try to involve this specialty. We can mention too the psychiatrists, psychologists are very important too, because the insomnia, sometimes we have to develop this kind of therapies, like behavior therapy, that they can do it much better than us. Then the ENT are very important. Why they are very important? Because remember, we have to evaluate the upper airway. Then if the patient have any like a obstruction, fixed obstruction in the airway, or maybe the palate have any problem, any abnormalities, or the tongue or something, that we have to evaluate with the ENT. They maybe can do some kind of surgery, like pharyngoplastic, and then they can fix it. Or maybe there is any problem in the septum, they can fix the septum, or maybe remove any polyps. Then they are very important in the evaluation of the people with sleep apnea, for example. The dentist and the maxillofacial, very important too. Today, we know that we need to evaluate the craniofacials, in the patient, because they can have some like fissures that can increase the risk to have any kind of disorder. Specific, for example, is obstructive sleep disorder. Then they can evaluate the patient, and sometimes we can use some devices that they can make. Then like a tongue retainer or advanced mandibular devices, then the dentist can prescribe, and they can create it and evaluate how the patient is advanced with these kind of devices. Then we were talking the dietitian, is very important, because remember, the weight is important. Then we have to involve the dietitian in this. We have the myofunctional therapy too. Then this is important, like speech therapists. They are involved too in this specialty, because when they give the patient some myofunctional therapy, they can increase the strength of the muscle of the pharynx, and then the people or the patients can improve. Then I am mentioning, I don't know if I have anything else, any other specialty that now, but we have to mention too internal medicine and the family doctors. They are very important, because they are, seeing many patients, and they have to be aware about the importance of sleep, and how to identify these people that has problem, because usually the patient sometimes is not coming and is going to tell us they are snoring because they consider this is normal. The most important, symptom that the people come to see us and sometimes says that they cannot sleep well, but the rest of the things sometimes is difficult, and we have, to be active in order to know if the patient are having any trouble during the night. Finally, I think we have the respiratory therapists. I left to the final because they are very important, and they are very involved in this kind of specialty. The respiratory therapists are key in the diagnosing of the sleep disorder, especially in obstructive sleep apnea. Their training in respiratory makes them ideal for this field. Then I am very happy to be working with a respiratory therapy presently. We are working together. Then the artists perform study polysomnography in lab or at home, monitoring the pattern of the sleep of the patient. They are involved in the treatment. They help the patient to start with the CPAP, AutoPAP, or BiPAP machine or therapy. They adjust the equipment, provide the follow-up. They teach, the patient about the sleep hygiene, treatment option. For example, we can say, well, this mask, but maybe this one is better for you. Then, well, they are training for, for many things in this field. They know how to manage this kind of condition. They work closely with the sleep specialists and pulmonologists to create a monitor treatment plans. Then, as I told you, I am very thankful and happy now, because we have our RT and we are working together with our patient with sleep apnea. The artists can specialize further in sleep medicine and opening doors to advanced roles in telehealth opportunity. I think because that This is the reason that African Respiratory Care Association and Guyana is supporting, this area most of the time, and well, the development of the respiratory therapies and the sleep medicine is very important. We are very happy that we have this opportunity today to share with you this kind of, how can I say, this kind of approach of this subspecialty. What are the key takeaways we have? Well, sleep is dynamic and regulated state, not a passive time. Then when we are sleeping, we are resting, but our body is not completely in a passive state. Neurochemical balance is essential to transition smoothly between wakefulness, non-REM, and REM stage, and wakefulness. Sleep disorders affect health. This is very important. Performance and quality of life, and should be systematically addressed. Sleep medicine continues to grow with expanding research and awareness. Finally, in conclusion, we can say adequate sleep is a cornerstone of health. Recognizing the sleep disorder through education and early diagnosis is very important. And the interprofessional collaboration can enhance the patient outcomes. Finally, I would like to sincerely thank ARCA for the opportunity to share this important topic. And I would like to thank Dr. Bacos too, because she is always encourage me to continue to do this kind of presentations. It is an honor to contribute to this field and the advancement of sleep medicine, and the collaboration with the rest of professionals who are equally passionate about improving patient care and outcomes. We have the reference here. And I would like to finish with this phrase that sleep is not lost time. It is when the body heals, the mind resets, and the soul breathes. Thank you so much for your attention.
Thank you so much, Dr. Sierra. And this is very insightful and very educative. I'm sure our participants have learned a lot on sleep. And at this point, I would like to go to the Q&A and see the questions that our participants are asking. So we have George Chenibua. George is saying, why do we dream during sleep?
Why we dream during sleep? Yes. Well, I think the dreams coming during the REM sleep is related with our daily, our daily time, and it's coming to refresh our mind and to promote the memory consolidation.
Okay. And another question. I cannot sleep more than 3 hours. If I don't take sleep pills, what do you recommend? So, yeah.
Well, in this case, it's very important to go to the doctor, because first of all, to take pills, tablets to sleep is not the best, choice. We can use this kind of tablets like benzodiazepines for a short period, but we have to start, with a sleep hygiene. We have to create the environment. We have maybe create a diary of our life, starting, go to sleep at the same time, and we have to awake at the same time. If I go to sleep at 10 and I'm going to awake at 6 o'clock in the morning, then every day I should do that. I cannot sleep more than 6 o'clock, because then when I'm going to sleep in the evening, then maybe I don't have enough sleep, because the depth of the sleep is accumulating during the day. Then it's very important to go to the doctor and set a clinic in order to try to change the medication, and we can use melatonin pills, but we have to be in contact with the doctor to create the sleep hygiene, a routine, that's something. Remember, the bed is just to sleep. We cannot come to the bed with any work, because sometimes we use the bed that I have to do the presentation, for example, I'm going to do here, and then I pass my time. No, the bed is just to sleep. It's not to work. It's not to study. We have to go to sleep when we feel that we are going to sleep. We should avoid to use the devices, because the lights of the device, reduce the melatonin secretion. Then we have to try to avoid to use these devices during the night. That can help. And maybe the melatonin is going to be something that can help too. But definitely the doctor should be, in charge in this transition.
Right. Another anonymous question, say, what does it mean in this case you are not recommending sleep tablets? We have sleep pills.
Well, I am not saying I'm not recommending. What happened? We can use for a short period. Then in order to organize our circadian rhythm. Then maybe we can use for a short period. But we have to start working since the beginning in our hygiene sleep. Then creating this kind of a routine. All right. And then after we can, reduce this kind of tablet pill, usually benzodiazepines that we use to sleep. And after we can, start with the melatonin that is going to increase the possibility to sleep, because it's a normal hormone that produces our body, and we can use some pills like this.
But they have to see a doctor or a specialist.
Yes, definitely we have to see a doctor. Definitely we have to see a doctor.
Okay, another question. So what causes people to talk? What causes people to talk in their sleep? Also, why do some people sleep with their eyes open?
Sorry, pardon?
What causes people to talk in their sleep? And the second question is, why do people sleep with their eyes open?
Where is the eyes open? Sorry.
The eyes is open and they are asleep.
Oh, yes, I understand now. Well, being honest, why we are talking during our sleep, this is a non-REM disorder, because we are, let me try to organize in English. When we are talking during the night, because we have some non-REM disorders, then maybe we can talk because we have something in our mind, then the REM sleep is not completely well, and we are having these kind of disorders. And the open eyes, well, I am going to be honest, I don't know exactly. I can say that because I'm honest. I have never think about why the people can be. I think if I'm going to tell something, it's because I think you are so tired, and maybe you are in the first stage of the sleep, maybe in the light sleep. For me, in my because I never think about that, but thinking about the physiology and everything, then if you have the eyes open, it's because you are so tired, and maybe you didn't have the proper time to sleep, and then you are in the slight phase, the N1, and maybe you can be like asleep with the eyes open because you have to do something. For example, you have to drive or you have to do something, and then this is coming in at the time because the tiredness of the 7-day time of sleepiness. I think it's because that.
Right. Another question. How do I prevent snoring while sleeping?
Well, I think the most important thing to prevent the snoring is the weight. The weight. We have to try to have normal weight. Even though there are some family that maybe have this tendency that maybe snore, because there are different factors that influence the snoring, and one of them could be the neck diameter. We can say this kind of person that have a big neck like is something that increase the probability to have a snoring. But it's something that is coming with the family of the person. But if you are overweight or you are obese, you are going to have more like a soft tissue here. Then when you are laying down, everything is soft during the time that you are sleeping, and then we are going to have a collapse of their weight. I think prevent snoring. The most important thing is, to have a normal weight. Okay. Eat
So you
properly
should watch their
and
weight.
do exercises.
Right. And then from Maha, she said, "Thank you so much, Dr. Sierra, for this amazing and inspiring webinar. It was truly valuable. My question is, what message would you give to healthcare professionals who underestimate the impact of sleep?"
Okay. I think, the message that I can send is that we have to be aware that the sleep disorders are prevalent. We have to go and we have to ask, because most of the people don't come to us to tell, I'm snoring or something like this. Just the most important complaint is the insomnia, but it's not the only. We have the movement, problem. We have the snoring. We have the other kind of problem with the circadian rhythms. And then we as a doctor have to keep in mind, as RT, as an educator, that the sleep disorders are prevalent, more prevalent, are underestimated. Then be aware about that. We can go and we can be active in order to try to identify the people in risk.
Okay. Another question. What happens when one sleeps? What is going on? Where do they go? And what does their spirit go?
Pardon?
Do you understand the question? It says, what happens when one sleeps? What is going on? And then where do they go? And where does their spirit go?
Well, this is a hard question. I think, well, being honest and being professional, I think we don't go to anywhere. We don't go to any other place. We are here all the time. Our spirit isn't on because we are breathing. If I am going to talk like from my point of view, then I can say if we are breathing, we have our spirit in the God spirit in on. Then we don't go to any place. It's just the time to rest, the time to improve our immune system, to boost the immune system. Is the time that we can consolidate our memory. The dreams contribute to our consolidation memory, consolidate our memory. Well, I think we are here until we die.
Okay, so the spirit still stay in your body. Okay. All right. Now, another question says, my name is Diana. Thank you very much. Please consider my question if it is suitable for this conference. I am a student and many students try to minimize their sleep hours. However, the literature mentions many present and future disadvantages for our health. In this sense, what effect do yogic, it has to do with yoga. So yoga techniques and meditation have in allowing someone to sleep very little and still avoid these health problems.
Okay. Yes, I think when we are studying, I understand this point of view from the student, because all of us, we were a student and we continue studying, no? And we know sometimes we are not sleeping well, and it's very important to consolidate the memory. Then the yoga and this kind of practice, I think sometimes can help, because we can relax, and it's very important to have a good period. Our body may be relaxed to go to sleep without any overthinking. When we are overthinking something, then we are not going to get a good sleep, because we are overthinking. this kind of meditations and yoga maybe can improve and we can relax, and it's going to be good for the sleep. And on another hand, I think even though we're studying, we have to plan to sleep properly, because we have or we want to consolidate our memory for the future, because it's not only the present time, it's the future. When we graduate, then we have to organize our time in order to try to sleep the enough time in order to have a good memory and preserve our knowledge.
Okay. So I haven't received any more questions, but okay, one question just popped up. I have seen people stand while sleeping. What is the cause?
Pardon?
I have seen people, the question says, I have seen people stand while sleeping. What is the cause?
Stand.
Yeah, they are standing and yet they are
This
bending
is
over to sleep.
it's a sleepwalker.
Oh, yeah, like that, or
The
sleep
sleepwalker.
stander or
Yes.
something. Either way.
Definitely, this is a disorder of the non-REM sleep. The cause of that is dysregulation in the central nervous system. This is something that is more related with the neurologists that we can, the psychiatrists, in order to try to improve this problem and improve the time of the non-REM sleep.
Okay, sure. Yeah, so I think on that note, thank you so much for answering these questions for us. On this note, I would want to say a big thank you, and this is where we end the Q&A session. This is very informative and very educative. We look forward to more sessions on sleep, because sleep is a very broad topic which has many aspects to be treated. So on behalf of the Africa Respiratory Care Association, we say thank you for making time to educate us and present on this session. So at this point, I would like to also inform everyone that this webinar is proudly brought to us by the Africa Respiratory Care Association and also Zopec Medical. So Zopec Medical, as I said earlier on, is a company that designs the world's smallest UPS batteries that supports all medical devices. Now, aside the UPS systems that they also provide what we call the sleep CPAP devices, so devices that can support you in sleep, or when you have some sleep disorders and you want to correct it, they have devices called the sleep CPAP device, and then also batteries that can support those machines whilst providing the solution that you want for your sleep. Now, at this point, I'll ask the IT team to also project some other flyers that we need from ARCA. Thank you very much.
You're welcome. Most welcome.
So ARCA is also active on all social media platforms. You can also participate on previous webinars on our YouTube channel. Just type on or type Africa Respiratory Care Association on YouTube and you see the previous webinars that has been posted over there. Embarking on a survey. We want to know that you really need respiratory therapists in your various country. Therefore, this survey, validation of respiratory therapy profession for Africa healthcare system, has come to be. Now we are inviting all non-respiratory therapists, which means all pulmonologists, doctors, nurses, all the other health professionals to fill out this survey. We want to know your thoughts about the profession respiratory therapist. If you're a French person, you can scan the French QR code. If you're English, you scan the English QR code and participate in the short survey. Your involvement in this survey will go a long way to help validate respiratory therapists across the continent of Africa and the world at large. So kindly scan this. I'll leave it on the screen for some few seconds, and then we'll move on to the subsequent flyers. Okay, so at this point, this is where we draw the curtains down on our webinar series. Thank you all for participating. It's bye for now.